Good afternoon, and thank you for joining us today for Preventing Caregiver Burnout, Creating Your Self-Care Plan. My name is Ashley Hawes. I'm the Director for Consumer Information at Benjamin Rose Institute on Aging. This session today is being offered as part of the Administration for Community Living Alzheimer's Disease Program Initiative Project, expansion of dementia-capable communities within urban and rural settings in Ohio, using evidence-based and informed programming. Today's webinar will be recorded. During the webinar, you may submit a question at any time using the Q&A button at the bottom of your screen. We do have staff monitoring the questions in the chat to convey your questions to our presenters and to answer any technical questions that you may have. You can turn on your captions by selecting Live Transcript, the button with two C's at the bottom of your screen. We are conducting an evaluation of our dementia education sessions as part of this project. You should have received an email with a link to the pre-session evaluation questionnaire, which also contains further information about the evaluation. If you did not have a chance to complete the pre-session questionnaire, we ask that you please complete this now using the link provided in the chat. By doing so, you are helping others in your community. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and the people who support them. I now have the pleasure of introducing our speakers for this afternoon's presentation, Christy Horner and Jenny Woodworth. Christy Horner is the founder and executive director for Courage to Caregivers. She graduated from Denison University with a BA in economics. Throughout her career, Christy has worked in a variety of nonprofits as the Director of Special Education Events, Director of Volunteers, and Director of Admissions. In 2014, Christy lost her brother to suicide. She had been one of her brother's long-distance caregivers for 4 years. As a caregiver for someone living with mental illness, Christy knew that there had to be a better way to support caregivers, so the idea for Courage to Caregivers was born. Courage to Caregivers is a nonprofit started in Northeast Ohio, now serving caregivers throughout North America, with the mission to provide hope, support, and courage to caregivers and loved ones of those living with mental illness. Next, Jenny Woodworth serves as the Director of Programs for Courage to Caregivers. Jenny graduated from West Virginia University with a bachelor's degree in social work, and she earned her master's degree in social work from Cleveland State University. She has a rich variety of experiences across populations and settings, and is passionate about supporting mental health and wellness in families, individuals, and especially caregivers. Jenny strives to bring compassion, a sense of humor, and hope in all her interactions. Please join me in welcoming today, Christy and Jenny.
Thank you so much, Ashley. We really appreciate that warm welcome. So thank you. We are thrilled to be here, both Jenny and I. We love these types of conversations, and we hope that you sit back, you enjoy this time. Jenny and I like to present it very much in a fashion that feels like a conversation with old friends. And as we've navigated the last few years together, we definitely have grown to become old friends. So are you providing care to anyone else? Maybe a family member, a grandparent, a parent, a child, a grandchild, maybe a neighbor, friend, or colleague. Then you're a caregiver. I'm a caregiver too. We are caregivers, Jenny and I both. So we always like to start with a check-in. And we just want you to notice today, how are you really feeling? Quite often as unpaid family caregivers, and likely as a professional caregiver too, people don't often ask you, how are you feeling today? They're most concerned about our loved ones or those in our care. How are they doing? So we really want you to think and sit and notice, how are you feeling today? And we've given you a little diagram and perspective on flourishing, languishing, and stuck. And we're going to come back to those later in our presentation. We have a lot of great content to share with you today. But we've given you some words around flourishing, languishing, and stuck. And we just want you to notice, where do you feel like you're feeling right now? Just keep that tucked away in your head.
Thanks, Christy. I love having those words to normalize and talk about why we're feeling the way we do sometimes. So I want to talk a little bit about the problem, compassion fatigue versus burnout. And as I'm going through this slide, I always get this slide and I always want to like move around, because when I'm talking to you about, many of you, including myself, have experienced some of these things as caregivers, as humans. When I start talking about these descriptions, I get a little squirmy. So some of these things are emotional, physical exhaustion, health problems, lack of sleep, irritability, stress, all of those things. My guess is you felt some of those. I felt some of those too. Totally normal experiences. Compassion fatigue, which I'm going to define here as the physical and mental exhaustion and emotional withdrawal experienced by those who care for sick and traumatized people for an extended period of time. Probably many of you on this phone call, on this webinar. Again, it's a normal response because you are managing an extreme experience, like being the constant caregiver for someone with an inconsistent illness, or supporting people through that caregiving journey. Burnout comes on slowly as the stress of caregiving builds, but compassion fatigue is like, boom, it strikes quickly as your resources hit the empty line. So we see Courage to Caregivers as being in the caregiver burnout prevention business by empowering caregivers and building their resilience, superpowers, or tools for their toolbox. And we'll use both of those terms throughout this presentation. Courage to Caregivers is all about self-care and personal wellness for the caregiver. And you've probably heard things like you can't pour from an empty cup or put your own oxygen mask on first. You have to take care of yourself to take care of someone else. And we're going to talk about the whys and hows of that more as this presentation goes on. So signs of caregiver burnout, what does that look like? Again, there's some overlap. There's less energy, emotional exhaustion, all those things. Reduced productivity. You've got to wiggle, I get it. So I'm going to take a moment here before I jump into the solution and just do a little bit of a breath break with you. And I mentioned that today because we consider breathing and meditation, these are one of our favorite portable, sustainable self-care tools to help better manage stress for caregivers. And we have on our weekly breathing meditation recordings, those are on our YouTube channel. So I just want you to take a breath break with me. I don't want it to be fancy because breathing, we do it all the time, right? I want to bust some stigma around what does it look like to breathe right? You're doing it right. You don't, there's no shame or stigma around that. Just look at this playfully, curiously. So sit with me here just a minute. You can close your eyes if that feels good. Or you can make, some people don't like to close their eyes. Put your eyes kind of a downcast gaze, and keep your body loose. It's hard for me when I'm presenting, so like so keep your body loose. No one's watching you. Why don't you just take a breath in through your nose. Hold a little bit at the top and don't scrunch and hold. Try to keep that loose body, just whatever feels good. And then let it out. For me, it feels good to let it out via a sigh. So breathe in. Hold at the top for just a little bit and then breathe out. And if you want to put some numbers or language around it, breathe in for maybe 4. 1, 2, 3, 4. Hold at the top. 1, 2, 3, 4, 5. Breathe out. 1, 2, 3, 4, 5, 6. I'm going to count one more time and then we're going to move on. Breathe in. 1, 2, 3, 4. Hold at the top. 1, 2, 3, 4, 5. Breathe out. 1, 2, 3, 4, 5, 6. And if you have to stretch and shake, I get it because I often do too. So when we talk about all this, what's the solution? What does that look like? There is a science behind self-care. That's something we're talking about here. We know that it can help improve immunity, increase positive thinking, and help us to be less susceptible to stress and other emotional health issues. I bring this up because of this pretty dire looking statistic on the screen. Family caregivers experiencing extreme stress have been shown to age prematurely. This level of stress can take as much as 10 years off of a family caregiver's life. So we came up with this presentation to help get you back some of those years, to have you start making a plan. It's always, oh, take care of yourself, take care of yourself. But without that plan, it's not going to happen, right? So Christy, talk to us about trauma-informed self-care. Yes.
And I think that's more important today for this presentation than any other, Jenny, because I think, as we talk about the urban and rural caregiver and their specific needs, especially for those caring for those with dementia and other disabilities, including any serious illness or mental illness, developmental disabilities, physical disabilities, the burden of care on those unpaid family caregivers are just exponentially higher. And they're high for all unpaid family caregivers, but we know that these audiences specifically, it's exponentially higher. And the pandemic has really shown that and brought to light some of those issues. We hate just talking about a problem without offering some solutions. And so nobody likes that, because you're all going to sit there and agree with us to know that we know the why. It's going to be availability of services, access to care, which includes transportation, respite care, and resources. And we want to focus on the how we can address this in a really trauma-informed way. And this goes for both the professional caregivers in the audience, but also those unpaid family caregivers. For instance, when we might say to a client or a friend or a colleague, hey, exercise, just go to the gym. Well, that may not be accessible for someone in those settings, right? For many reasons. Access to care and then privilege, resources, all of those things means to utilize a gym for a workout. So how can we pivot that type of movement in a way that doesn't involve heading to the gym? That's an example of trauma, making self-care trauma informed. And so how can we pivot those things? We also want to address the elements of trauma informed, which includes safety and building trust. So we also know that caregivers in these settings, establishing that trust is going to be very important for you as a professional caregiver, but also as a peer. A neighbor just can't walk up to another neighbor and knock on the door. You have to establish that trust first and get to know them before you can just knock on the door and offer to help. Peer support is going to be really essential component to trauma-informed, and you'll hear us talk about that a lot today. Finding the collaboration and the mutuality, normalizing, as Jenny's already said today, our situations as unpaid family caregivers, reclaiming that voice and choice for those caregivers, feeling like they do have a say in their care, and then taking into consideration all of those unique differentiators for those demographics are going to be really important for us as we talk about self-care. We also know that self-care, which we often talk about as taking care of our own health and well-being, we have to take care of our own health and well-being to provide the very best care to those in our care. And that goes for anyone that we're caring for. And so how do we do that? And that's why we're going to be talking about a plan today. We also kind of want to define for you just a tiny bit trauma and resilience. And I just gave you that overview of what is included in trauma-informed care. But resilience is our ability to bounce back from trauma. There's a definition of resilience as mentally or emotionally coping with a crisis and returning to pre-crisis status quickly. And that becomes very important for caregivers. We face a lot of caregivers in our a lot of crises in our day-to-day lives as caregivers. I always appreciate looking at resilience as a mindset, which we can learn and grow over time. And there's a lot of different components to resilience. But for right now, Ashley, let's see, does anyone put anything in the chat about what is their go-to self-care practice before we start talking about creating the plan? So if you were to, for today, what would be your number one, your kind of go-to, what do you do for self-care to take care of your health and well-being? We just want to hear what you like to do. For me, it's about stepping away from the screens, because I spend a lot of time on my screens these days, and getting outside And if I can't leave my loved ones, I have to stay close. Even just opening that front door and getting fresh air, even on a day like today, where in Ohio, it's very blustery and cooler, getting fresh air. But if I can, getting a walk and taking my 2 dogs with me, factor in a friend, and I have that social support. What are some go-tos, Ashley? What are we seeing in the chat?
Yeah, Christy. So we actually had people share that they also like to go on a walk and walk their dog as well. And there's a lot of different activities like art, painting, crafting, knitting.
Great.
And someone also shared that they use self-compassion.
Oh, those are our people right there. Jenny and I love talking about self-compassion. And I will notice the crafts. I'm really impressed with y'all. During the pandemic, there's a few things that went away for me. One was reading long novels. Luckily, I've got that back. Crafting, which I love to do, I just couldn't make time for it. Over Thanksgiving, I made it a goal with my family to do a craft. So I got crafting back. So I'm so glad to hear that crafting is part of their self-care as well. Jenny, do you have any favorite go-to self-care?
Oh, I like to walk. I'm getting back into cooking. Christy, I think these pandemic lulls we had, I used to cook as self-care, and I'm getting back into it. So it feels good sometimes. And if my kids eat peanut butter and jelly, so be it. I'm going to eat something more fun.
That's great. Making cooking fun, making those daily activities more fun. I think that's great. We can include our loved ones in that. I know I have a son with a traumatic brain injury with a developmental disability as a result, and or I guess a disability as a result. And including him in the cooking has been a really great both therapy for him, but a great way to include him in the process and get him active as well. Now we're going to talk about resilient superpowers. And so put in the chat, we want to hear from you. What is your resilience superpower? And we just kind of gave you that definition of bouncing back, and especially to a pre-crisis, and caregivers face those crises every day. So I want to know, what's your resilient superpower? You'll see here, self-compassion was someone's self-care tool. Jenny, self-compassion is your resilient superpower, which I love.
The person out there, you and me, buddy, I feel like I didn't know about it sounds weird to say I didn't know about self-compassion until the pandemic, but it's really true. And that's when I really had to say, oh my gosh, like everyone's struggling right now. I am not alone in this struggle. I love normalizing. And that's a big part of self-compassion for me, is to remember that we're all in this together. We all would feel this way in this type of situation. And I use it more than pandemic at this point. I use it a lot in my life. Christy, yours. I love yours.
Mine is hope. And I just can't get enough about talking about hope. And it's that belief that tomorrow is a new day. I get a fresh start, that things will get better, that there is a light at this really long end of this really long journey or tunnel of caregiving. But I heard a quote recently that maybe I'm getting that wrong, that there isn't a light at the end of the tunnel. What if we were the light and we had the ability to light our way? Isn't that kind of hope? And so that's the way I choose to look at hope, is that I am the light in this tunnel, really long journey of caregiving for me. And so, Ashley, what do we have? What are some resilient superpowers in our audience today?
So one that I thought was really interesting was that someone shared that their superpower is having gratitude.
Yes, so good. So essential. And forgiveness and gratitude. And that goes for both ourselves and for each other. And I love thinking about that with regards to kind of being gentle with ourselves and each other, because as caregivers, we know we need more of that too. So thank you for sharing that one.
Another one, you guys mentioned normalizing. Someone said that they remind themselves that they're not alone.
So important. And that's why we're all here today, right? Because sometimes we have to build our community of care in this virtual space. And especially for the audience of the urban and rural caregiver, it can be really, that isolation and loneliness can feel like no one else is going through what we're going through. And even though my experience as a caregiver is very different from yours and Jenny's and Ashley's and everyone else here, that relationship of care, the act of caring, is what is what brings us all together. We're all carers and we face some of those same challenges. So I appreciate that. Jenny, I think it's time to start on our plan.
Yeah, let's get that fuel to allow our light to shine brightly. I just want to do a quick definition for folks about professional caregivers versus unpaid family caregivers. One is not more or less than the other. We use that term and sometimes we just get rolling because we use it so much. Unpaid family caregivers are folks that are caring for people in their homes or from afar. Professional caregivers are like social workers, nurses, all those things. You can, many of us are both. But again, there's no hierarchy. It's just the terminology we use. I just want to put that out there. You are all valid here. All types of caregiving, utterly valid here. So take a second here and I'm going to take a breath because I forgot about that definition and I just wanted to put it out there midway through our presentation. And I want you to just take out, if you have a self-care plan, hopefully was sent to you previously, will probably be sent again. I print it out every time I do this presentation because I could never find it. So that's my problem. You need to print it out, fill it out, put it somewhere you can find it. And while we're sitting here getting ourselves together, take a couple breaths. And I'm going to talk to you quickly about affirmations because they may be something on here that you're like, what is that? Affirmations for self-care, affirmations work to replace a negative thought pattern that can often be part of your inner dialogue. Oh, the sun just came out. Hold on one second, y'all. We didn't think the sun would come out. So let me pull my blind up. Thank you. Cracks me up every presentation. I'm like, it's so cloudy. Where was I? Affirmations. So we are changing those negative thought patterns and giving why don't we try some positive thoughts and affirmations, some space in our brain? Because I'm guessing that negative thought patterns have had a lot of space in your brain. So as you're thinking about creating a self-care plan, maybe you can say to yourself, I enjoy taking care of myself. That's an affirmation. Now, is it always true? Maybe not, but is it something you want to be true? Yes. Or creating a self-care plan is easy. It's another one. Being a caregiver brings me enjoyment. Maybe not every day, but maybe that's something you want to try to replace some of those negative thought patterns. So just for some food for thought. So as you're creating this, as you're kind of sitting through the last half of our presentation, maybe think about some affirmations to replace those negative thought patterns. So having the self-care plan in place, it's crucial to being a caregiver, to providing that type of support. I want to try to bust the myth that self-care is selfish. Like I said, you can't pour from that empty cup. I want to focus just a little bit as you're filling this out on some elements of self-care, physical. So as you're thinking about, what brings me joy? What are some small things I can do? All things we're going to talk about more, but think about, is sleep self-care for me? Is exercise, nutrition, physical elements of self-care? Emotional. So, feeling emotions without judgment, seeking connectedness from peers or family. Psychological, that bit of self-reflection, that, curiosity, that playfulness I kind of invited you to bring during the first breath break that we did. Trying to find something inspirational, something that brings you hope. And there's also, for some of us, professional caregiver, whether we're professional self-care, whether we're professional caregivers or not. Maybe you have a whole nother job in addition to being a family caregiver, but connecting and catching up with colleagues, have healthy boundaries with work, seek peer support, all those things to think about as we talk more in depth about the self-care plan. One of my favorite bits is the micro joys that I want to talk about next. And that's a big section on this. Well, at least what brings me joy is a big section on this. And I want to invite, this is one of our invitations. Yes, if anyone wants to put in the chat now as I'm talking, what brings you joy? Oh, I see lots of chats. My joy on the screen, and you probably saw me drinking it in the beginning of this, is hot coffee. I spent much of my life as a mother of young children, they're still relatively young, drinking cold coffee when I found it later. So I really enjoy drinking hot coffee. Oh, my baby's giggles, that one just popped up. Christy, what is your micro joy?
Also, it happens to be my go-to self-care practice, right? It's taking a walk out in nature with the pups. And it's a perfect example of in Ohio, there's no such thing as bad weather, only bad gear. And so that can't be a barrier to me getting outside to bring me joy. Even the dogs have little coats, as you can see there.
Nice. What about other folks? I see some in the chat. Ashley, do you want to share with us?
Yes, so people have definitely agreed about the coffee. And there have been several people talking about music or Christmas music specifically.
Isn't that great?
Oh, 'tis the season. Nice.
Mm-hmm.
Also, you did, Jenny, mention the one about the baby's giggles and then laughing with family members.
That's such a great coping strategy too. Laughter. We often forget about that. Often we think of joy as elusive and big, but it really doesn't have to be, as Jenny did a really great job talking about those micro joys. So we really invite you in that section on your self-care plan. Think about those little things. Think about even reframing something like the cold coffee into how can I keep that coffee hot? How do I do that? Right. So I happened to get Jenny a little plug-in.
She wants me to show the thing. Yeah.
Yes. So that she could keep her coffee hot. Sometimes you just gotta,
So nice.
Pivot that, like the dog coats and the coaster there. So that's great. The next part of the plan that's got a big box is we really want to talk to you about your strengths. As caregivers, we're so good at that negative self-talk Jenny was mentioning and living in our head and beating ourselves up about all the things we're doing wrong or not good enough. And it comes back to, wait, we have a lot of strengths and we have strengths way outside of our caregiving roles as well. So we really want you to dig in deep. Think about all the things you're really good at, your absolute best strengths. And we gave you a little chat link. It's going to be in the chat to viacharacter.org. And you can take a little survey. They're not going to pester you with emails. All you do is just access their survey through that little registration. It's the way they check the impact metrics that their tool is making. We want you to put in the chat what your signature strength is. And we hope you have lots. But for me, it's about, I think of myself as a problem solver. And so I try not to be a fixer. I've got one of those in the house already. So I try not to be a fixer, but I do like to look at a problem, try to be a problem solver. And from the time my kids were born, they still talk about this. Encouraging them to be problem solvers is really a great way to empower them to look at those problems for themselves. And then I don't have to be a fixer. Kindness is what actually came up in my VIA character strengths as my top character strength. And so being reminded of that and how I can use it in my caregiving even more helps me to face my caregiving with a lot more patience. Jenny, what's your strength?
Mine is, going out of my comfort zone, and it's hard. But again, like this little screen says, that's where the magic happens. I recently started singing as part of a chorus here locally in Cleveland, something I've wanted to do for years, and I finally just bit it off and did it. It brings me a lot of joy. And if I didn't have that ability to step out of my comfort zone, I would still be just singing in the shower and annoying my family. So I was really happy to do that and to focus on what happens outside of my comfort zone.
That's very impressive. Very proud of you for that.
Well, thank you.
Ashley, what are some people's signature strengths?
So someone has said that they are a good project planner, so they're able to predict problems and putting systems in place to keep things as smooth as possible. Someone also shared that they have a high tolerance and lots of patience.
That's awesome. These are so important for caregivers, right? So both of those things. And guess what? If I don't possess one of those strengths, but we know someone in our support network, which we're going to talk about here in a minute, has that, you can create this incredible team with all of these different strengths. So Jenny and I actually share a brain, even though we live on two different sides of Cleveland. And it allows me to leverage our collective strength because I can include her in my support network and know that she's going to push me out of my comfort zone when I'm really comfortable over here, focusing on some of these other things. So leveraging everybody's collective strengths are going to be so important to navigating these plans. I love both of those strengths. Those are amazing. Jenny, what makes self-care micro? I mean, how do we do that?
I think we started saying this a lot during the pandemic because, like one of my self-care things was going out to dinner with my spouse. And that, of course, literally restaurants closed down. Y'all remember that? So it was about modifying those little things. But, micro self-care can actually work in almost any situation. If you aren't able to leave that home that often because of your caregiving role, if there are other barriers because of, where you live, who you're supporting, all those things, how can you make these smaller? How can you modify and pivot? Yes, I would love for all of us to take an amazing vacation with a beautiful spa and just forget about it all for a while. But I'm a social worker and a realist, and I know that isn't always what we can do. But how can we modify and pivot? Again, that's sustainable, portable breath work. That is micro self-care for me. I can do it when I am at the doctor's office. Oh, a doctor actually said to me, she says, "Why are you so chill?" Because she had taken 45 minutes. I said, "Because I've been meditating." Instead of getting pissed, I was meditating. And again, I was able to bring that with me. Am I perfect at meditating? No. But it's something I can bring with me that I've been able to modify and pivot. I can't always go to a retreat and do those things, but I can do it when I'm getting irritated at a doctor's office. I can take 5 minutes to connect with people, either via text or social media or call. What else? What are other good micro self-care? Hot beverages, all those things. Planning vacations. Even if I can't always take them, kind of going through the, beautiful Instagram or beautiful Pinterest and going, "Oh, look at that." I love looking at beautiful living rooms because mine is full of toys. I love looking at beautiful styles on Pinterest. That's a good self-care for me. How can you modify and pivot other things? So just think about that.
I also know, did you know that there's these great websites and a lot of museums during the pandemic and created these and have kept them, like museum tours all around the globe. I'll never get to go to some of these countries and see these beautiful museums, but they all took time to create tours for us. And we can see some of the most magnificent artwork and treasures from around the globe in these virtual tours and pretend as if we're in these fabulous foreign countries, including right here in Ohio. So I love the way that museums thought out of the side of the box there too.
Yeah, talk about pivoting, right?
Yeah. And I mentioned earlier that how important those circles of support are. And for myself as a caregiver in some very important different roles between caring for my son after his accident, caring for both my parents, one who's about to turn 90. And then you all heard I'm caring for my brother with severe mental illness. Having a support network where I could surround myself by people that I knew I could call on for anything, that unconditional love. And yet, what do most people say to you when they know you're in crisis as a caregiver? "Oh my gosh, if there's anything I can do, just call me." And so if you're supporting a caregiver, that's one of the worst things you could say. You need to be very specific. You need to get with the caregiver. And here's where we're really bad as caregivers, identifying what do you need? And actually keep it as a list. Put it on your self-care plan. What do you need? Because then when someone comes to you, and what I prefer to say is something like, "Hey, I'm heading to the grocery. I'm already going. What can I bring you on my way home?" And that way, if I just need maybe 6 apples, or I ran out of yogurt, or my favorite breakfast item, or my favorite healthy item, then that support person can do that really quickly and bring that to me. Or I'm headed downtown. Is there any errand I could run for you? I'm headed to a doctor's appointment. Is there any lab work you need done and you could schedule at the same time? So offering specific services when you're supporting a caregiver, but as caregivers, identifying what you need is absolutely essential. We also know that as rural and urban caregivers and those unique needs, that their places of worship can offer a tremendous amount of support. And I know, for instance, my place of worship not only supports me as a congregant, but actually supports the whole community. So if you're driving by and happen to notice a place of worship, please reach out to them if they're in your community and close by, because you may not need to be a congregant or a member of that community for them to support you. It's part of their mission. It's part of my congregation's mission, is to support the greater community. And they have all kinds of incredible supports. So think about your places of worship as a kind of non-traditional, or maybe if it is for you, a very traditional source of support. Sometimes it's other professional organizations like Courage to Caregivers, now supporting caregivers of all kinds, and our partnership with Benjamin Rose, them supporting dementia caregivers of all kinds. We do a lot of referrals back and forth to each other's agencies to say, hey, you're looking for a support group or some peer support, check out Courage to Caregivers. Or we happen to talk to a caregiver who's looking for some case management, and you're going to hear more from Ashley about BRI Care Consultation. We can do that, and they'll know and help you to navigate with all that case management, help you to navigate the deluge of people providing resources to give you those trusted, credible resources. Sometimes it's just navigating. If you try to just Google caregiver support, you got way too many hits on that. So coming to someone like Benjamin Rose is going to be help you to navigate that. So there's a lot of different people who are offering those different supports. I'd also encourage you to reach out and get to know your neighbors. And sometimes that's just chatting with people in the grocery line. There's days, plenty of days, I don't want to chat with anyone in the grocery line. But as I do, and I start to build that community, those kinds of support networks become very important. Keeping an eye on each other, especially in those urban and rural settings, and getting to know who's in your neighbors, who's in your community, so that you can be there for each other, you will be astounded by how rich your support network becomes just when you're starting to think that you are feeling very alone. And Jenny, did I miss anything there?
No, beautiful. Thank you.
Oh boy. I know. Why is this important? Nobody likes to talk about stress, but we have to understand it.
Dang it. Why do we talk about this here? So it's a huge component of understanding compassion fatigue. Christy and I are very sweet. If you haven't noticed, I'm just teasing. But when we started out this business, or this work, it was like, hey, let's try to remove some stress. Let's, remove the stress of caregiving. We're going to make everyone better. And gosh, we learned pretty quickly. We cannot remove the stress of caregiving through our programs or our presentations, through just being who we are. That's not a thing. We provide, support groups, peer support, but we want to empower folks to better cope and manage with the stress of caregiving, but know that we can't remove it. So if you want to start with identifying what causes you stress and measuring it over time, what thoughts and situations cause stress for you? And then notice, this is on your self-care plan. So this is what I understand about my stress. Where do I hold stress? And, I'm like right here right now. Like sometimes I'm like that slide. I'm like, anxious, quickly, yes, this presentation is a brief one today for us, but you can always notice and maybe tell that part of your body, hey, we're good. You don't have to hold this stress right now. I got this. I have a brain, I have a support network, I have a plan. Just a little bit of gentle massage to wherever you're holding stress is always a good idea. Notice when compassion fatigue is setting in. Notice when you're like, oh my gosh. Use your plan, work your self-care plan, but also look at this slide. This is my house and life. That is not my little cutie, but that is an example of my little cutie of, oh gosh, what is this? It was definitely this presentation we put together in the very beginning of the pandemic, when everyone was in our house eating all the things and leaving that mess in my sink. And I would just go, oh my gosh. So finally, I just said, hey, we all live here together. This is not a reflection on who I am as a person, this messy, stressful sink. And here you go, child. Here's a mop. Here is all those things that I can kind of go, all right, I'm going to have to let part of this go. I'm going to have to try to change up my stress, how I feel about my stress, how I feel about myself as someone who's doing housework here. I'm going to have to do that. I'm going to have to reframe, a way of changing your worldview to create thoughts, beliefs, and perceptions that cause less stress. Amen. I had to stop being annoyed at how messy it was in my house and come up with a solution that includes some of those people that live in my house. That's my example of reframing. And I would really like for you to start thinking about how can you reframe stressful situations. And even if it is, again, just using that lens of self-compassion. Right now, the dishes are dirty. This does not mean I failed at housekeeping or caregiving or any of those things. That's my gentle, quick version of reframing.
I think it's just essential knowing what your stress triggers are and where you hold it. That allows you to immediately, aha, I'm entering stressful situations.
Yeah.
How am I going to cope with this? It really heightens your awareness so much faster.
Yeah. Oh, these pigeons. So we talked about this word here in the beginning. We're going to share these articles that really got us thinking about these terms, because I think many of us were languishing during the pandemic. It was just kind of meh, ugh, those words, the shrug of the shoulder. And we really got a lot of input from this Adam Grant article. And then there's another side of flourishing. And again, we're hoping that, when you start to notice these things, when you start to think about where you hold stress and how you can take care of yourself better through using a plan, working a plan, that you're going to maybe move to a little bit more flourishing, that, general, like, ooh, okay, like I'm doing all right. That's where we're hoping everyone can be. Again, it's a continuum. I don't think every single part of your life is going to be flourishing. And again, this article by Danny Bloom, kind of her answer to Adam Grant's article, will give you some great tips for that. And we have a whole nother presentation on languishing and flourishing. So maybe, you could catch that another time. But again, this is about normalizing those feelings of like, ugh, I really want to normalize those for you today and every day. And self-care really can help to move to flourishing. Again, it's that plan. It's starting with that no one's else is going to take care of us. We have to do that for ourselves. We have to ask for what we need. Again, if it has to be micro to begin with, all of it, we get it. It's still forward motion.
It helps us to reclaim ourselves, right? It helps us to say, by focusing on my health and well-being and not putting off doctor's appointments and not putting off my own needs, I actually provide better care to those in my care, all the people I'm caring for. It's about giving the world the best of us instead of what's left of us. That's a Katie Reed quote, not Christy Horner. But it's really about, if we don't take care of ourselves, we won't be here to take care of anyone else. So if you can reframe it as that, it might be what you need to convince yourself that it's absolutely essential to take care of yourself, not only for you to flourish, but for your loved ones, your entire families to flourish. It's possible. It can absolutely turn it around.
Yeah, so obviously we are big proponents of a plan and goals. We talk about these things in our group. If you've never heard of a SMART goal, I'm sure you've heard of a SMART goal, but these are big things that we've talked about in group. But we also looked that when goals are big for many people, they're hard. They're changing yourself in a way that, it's a growth. It can be hard. It can be stressful. It can be one more thing. And if you feel like you have one more thing and you're already holding 12,000 things, I encourage, again, you to look micro. And so we have attached both here on the slide, and I think it's going to be put in the chat box and followed with later, our micro challenges calendar. Again, that was another pivot we made. Like, hey, this is hard. We get it. What are some small things you can do? What does this look like for you? Grateful to have this as a tool. I use this tool as well. I wanted you to just take a minute here. Take a couple more breaths with me. because we are moving towards the end now. We want to have time for your questions, but I, again, just want to emphasize how important breathing and sitting for even just a minute can how important it is for your well-being and how it can make you feel. So take a minute. And I saw a question in the chat box about physical anxiety. And I'm guessing that's like the wiggles or the holding of anxiety. So I'm going to speak to that in a second as a final kind of breath/movement practice. So if you want to deepen your inhale and push out your exhale, always feels good to me. But again, you breathe how you breathe for now. And if it's something you want to learn about more, please do. Please add it to your self-care plan. And if you're someone who holds a lot of anxiety and tension, I just invite you to do a little bit of this. Seems weird. Just try. And you can kind of shake your shoulders. You can say, oh, I've been sitting for so long. Feels good to use my body. And I saw what Christy was doing. Shaking feels weird. You can go, oh, a little stretch. And again, you can come back to your body and say, oh, here we go. There you are, stress. You're okay. I got you. My brain's going to take over. So again, doing this fast. Christy, finish up here, lady.
So this is on your self-care plan because we feel it's just so essential to navigating the journey as a caregiver. And the 7 C's that we created are really adapted from the 3 C's for addiction recovery. And we believe they're essential to dealing and coping with stress. I didn't cause it. I can't cure it. I can't control it. I know I can't change it. And yet I can have courage, compassion, and I can cope. And it's just that reminder to yourself. So we'd love to take any questions, Ashley, if anyone has any on anything, and know that people can certainly reach out to us for more information. But what are some of the questions we've got?
All right, so I know that you guys did answer the question about the physical anxiety. I do want to encourage anyone else who has any questions to go ahead and submit them using the questions box in the control panel on the right-hand side of your screen. While we're waiting for those additional questions to come in, if there are any, I do want to take the time, Christy and Jenny, to thank you both. This presentation was just so wonderful, and given the stress that we have around the holidays and just being so busy in this time of our lives, I think that it's just such a great topic to really talk about it and encourage everyone to come up with those self-care plans. So let me see if any more questions come in. We did have someone ask about where they could go for a self-assessment for dementia. That's not what's really encouraged. What we would like you to do is to please visit your physician and have a full assessment completed. That way that they can rule in or rule out anything else that may be contributing to any factors that you have going on. We are posting some additional information in the chat, just so you understand that there are additional causes to memory loss that are non-dementia related. So we've listed some here. It could be stress, depression, inadequate sleep, medication, and other factors. So really visiting the doctor or other skilled healthcare provider to sort out your symptoms is what you need to do, because dementia is not a self-diagnosed condition. Okay, so we did want to remind everyone that all of the slides, the recording of the presentation, all of the handouts, they will be emailed to you after the webinar today. We are getting a lot of people saying that they have completed those self-care plans, so that's really encouraging. And we do encourage everyone to make sure that they visit those links that Christy and Jenny mentioned, and to really, give some thought to those self-care plans. So I'm not seeing any additional questions come in. So I did want to go ahead and move over to our project director, Branca Prometica. Before we conclude today, she's going to tell you briefly about BRI Care Consultation. So Christy mentioned this earlier. It is a care coaching program available for families impacted by dementia. It is available in various counties in Ohio through the Administration for Community Living Project. Branca, can you tell us more about that?
I would love to. First of all, thank you so much, Christy and Jenny, for having us just kind of take a little break and think about ourselves as caregivers. I think that this is a very good, important reminder that that in order to care for others, we must care for ourselves as well. And so to help us do that even further, I'm going to talk a little bit about a program called BRI Care Consultation. This program is also known as We Care Because You Do, when delivered from the Benjamin Rose Institute on Aging. It is the same program, but this is generously funded by the Administration for Community Living for select counties in Ohio. So it is a telephone and email-based care coaching program. And so a care consultant, individual care consultant, is assigned to a family and works with them to support individuals, including those with intellectual and developmental disabilities, in various decision-making, various guidance that's provided. So things like finding and getting connected to health and community services, which oftentimes is a challenge for individuals and families, knowing where to go for trusted services. And so, and knowing, what it entails and if it's appropriate. So the care consultant really uses a very, easygoing but thorough assessment over a course of time to really identify, what is needed and getting connected. Also, this feeds into a step-by-step plan called an action plan that really prioritizes a caregiver's and the individual's concerns. So it is updated as conversations take place. So the care consultant may communicate, starting off every week, every couple weeks, once a month, depending on where the needs are, and updating as as time goes on. A lot of times the care consultant can help with communicating with other family and friends, especially when, managing those difficult situations and behaviors, kind of getting everybody on the same page on, what, especially for dementia, what it is, and, what to look out for and how to work through it. So, so that is an important role as well. The care consultant stays in touch, and I mentioned this when talking about the action plan. So, those periodic check-in calls to make sure that the action steps are going well and the families have been able to accomplish them, and making adjustments by adding new ones. And so this is an important piece, so families and individuals aren't left without that help and support. Also encouraging other family and friends to get involved, how to ask for help, what can they do, what small steps can they start off with, and even facilitating a family meeting is a very important role for the care consultant. Most of all, being there as an emotional support, because as caregivers, oftentimes there's challenges. And so care consultant is sometimes there to really normalize and to really empathize with the individuals that they're serving. So for those caregivers on the call, how do you get the service? And so you will see here with our Administration on Community Living project that the program is available in Cuyahoga, Lake, Geauga, Lorain, Medina counties through the Benjamin Rose Institute on Aging under the name of We Care Because You Do. you have that direct line that you can contact, as well as Welcome House. And this is an organization that serves individuals with intellectual and developmental disabilities. And so, you know, they are the ones to contact. We also have 2 rural areas that serve Washington County, Woods, and in Ohio. In addition, O'Neill Center serves portions of West Virginia. And then we have Athens County, and you have those direct numbers there. This information will be emailed to everyone who is attending, so you'll have access to this. And I encourage you to contact one of these organizations if either if the person you're caring for resides in one of these counties. If you are viewing this presentation from elsewhere, you know, you are more than welcome to contact the Benjamin Rose Institute on Aging, ask for BRI Care Consultation, and we can look for ways to link you to other parts of the country that also deliver this program. And that is it. So back to you, Ashley.
Thank you, Branka. We do want to take the time to thank you again for joining us for Preventing Caregiver Burnout, Creating Your Self-Care Plan. As I mentioned, a recording of today's session will be made available. It will be at www.benrose.org on the event registration page and in our resource library. We are offering more webinars like this for community organizations and families impacted by dementia each quarter of this ACL project. We hope that you will join us next year in 2023 for our continuation of our webinar series. And for those who are attending that are local, Benjamin Rose Institute on Aging next Thursday, December 8th, we will be hosting our annual caregiving conference from 9 a.m. to 3:30 p.m. This year's full-day in-person conference will focus on research and practices related to the identification, detection, and referral of individuals with Alzheimer's disease and related dementia, with emphasis on diversity and dementia diagnosis. To register or for more information, again, visit our website at www.benrose.org. Now in the chat, you will see a link to a post-session questionnaire. You will also be receiving it via email later today. We ask that you please complete the post-session questionnaire within 1 week following today's session. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and the people who support them. Thank you again for joining us, and I hope you have a great rest of your day.